So, a lot of health officials in Canada and around the world have been reluctant to say that Omicron is a much milder variant because they don't want to be premature, they don't want to call things too early, they want to wait for more data. And one can appreciate why someone might want to approach things that way. But I had a recent conversation with Dr. Neil Rao, who's an infectious diseases physician based out of Ontario, and he was talking about the difference between being cautiously optimistic, which is an appropriate thing, and cautiously pessimistic, which can come with a lot of harms itself. And Dr. Rao was talking about how if there are restrictions on our lives that are in place longer than they need to be, needlessly, ones that, well, we don't really particularly need them, but we've got them in place out of an abundance of caution, well, we have to start talking about the harms of those restrictions as well. And I think this speaks to, yes, the current moment where they are looking at Omicron data, but also our approach to COVID restrictions more broadly. We get that during the first wave, we thought, well, what is this thing? We're not even sure what we're dealing with here. Okay, go into lockdowns. That was basically the original rationale. But later on, we heard more and more restrictions being brought in just because we could, just because, well, why not? Just because out of an abundance of caution. Yes, we know COVID-19 doesn't particularly spread in the gyms, for instance, but, there might be a little bit of negligible spread and we want to flatten the curve. So let's shut those things down without really weighing the pros and cons of, well, negative health effects of shutting down fitness centers. Obviously, something people need to keep their metabolic health in good shape, which is one of the leading indicators, having poor metabolic health, of whether or not you will or will not end up in hospital after you contract COVID-19. It's nice to see more people talking about this. Dr. Rao has long been an advocate of striking that balance in terms of let's talk about weighing the negative consequences of keeping these restrictions in for too long, because more and more the data is coming forward talking about the negative costs, the harms that have come from so many of these restrictions on our lives. And as we're getting increasingly 2 years into it, I think more people are talking about all of this. More folks are saying, come on, we need a more balanced approach. So one gets being cautiously optimistic. Okay, things are looking good. Oh, okay, hopefully, fingers crossed, this is going to continue this way. Let's proceed productively forward. But the cautiously pessimistic, the okay, I can look around and I can try and find that doom and gloom data. And I can say why, well, hold on, 2 weeks from now, things might be absolutely chaotic. I mean, currently things are looking good, but they might be chaotic. All right, one appreciates why some people might come to that perspective, but there are consequences to pushing those perspectives. There are harms that come from that as well.